out of the room, I knew that, oh, I missed this thing and I'm going to fail. And literally the same stations I failed, which I knew I'm not going to pass. Like I missed this thing, although I performed well, but somehow I missed the important thing, and I realized, okay, I didn't say this thing, so I'm going to fail. That's how the exam is. We just have to, the know all the information we have is sufficient. We don't need to dig into further, not extra knowledge we need to know. Just if the patient mentions something, that as a doctor, as a working doctor, if we are sitting in our clinic and we somehow miss this thing, that's how they are judging us. One station which I failed, I got herpes in pregnancy. And that lady, she in the history, she clearly told me that she doesn't practice safe sex, but the case was herpes in pregnancy. So I was more into herpes management, that okay, look, this is the 19 week of pregnancy, so I'm not much concerned about mode of delivery. And I told about the previous immunity and all those things, but I did not mention I'm going to screen you for the STI. And so they failed me in management, because management was the predominant area. Yeah. So this is how we need to perform. Just we need to know the key points, and we have to be attentive and focus during the station. While sitting into the station, if we think that the role player is giving me some hint, just catch that as a doctor. If you think that you're not going to mention in the management, or somehow you are going to forget it, just say that immediately. Like if now I try to recall everything, and I'm sitting as the same candidate which I was there in that exam, I will not, as soon as the patient tells me that I don't practice safe sex, so I will immediately tell her, okay, so I'm going to screen you for the STI as well. Just mention this thing at that moment if you think, because I thought I'll tell her. But somehow when I came to the management, considering she's pregnant lady, and she was like, I'm worried about my baby, I'm worrying about my delivery, how I'm going to deliver with this, the burning sensation in my private part. So I just start getting into the HSC, and I did not mention about the sexually transmitted infection screening. So and once I was, because it's a very big huge management, the STI, the HSV in pregnancy thing, so somehow I missed the STI one. And while coming outside, I knew, oh shit, she told me she doesn't practice safe sex, and I did not say that I'm going to screen you for the sexually transmitted infection. So I knew it, that they are not going to let me go with this huge mistake as a doctor, because they are also judging me as a working doctor, that how would I manage my patient if the same patient come inside my clinic. So these like this. And somehow we also I got my very first station. I'll start with the feedback with the station wise. The first station I got was the psych station. the, there was anniversary grief station. I went inside, there was a young boy sitting inside, and he seemed very sad. I knew from the my role player, she was going for second attempt, so she told me that she did very good. All her psych stations she did very good. Even she practiced with Dr. Amir. She took Dr. Amir's psych class, so she practiced the same case with Dr. Amir as well. So she told that I clearly remember I did not miss anything, but I couldn't pass my psych station. And she told me that now that if she think about her performance, the only thing she missed was empathy. She told that I was just sitting as regular, like I'm dealing with any patient, not necessarily with the psych patient. So my tone was regular, and I did not reassured that patient that you are going to be fine, or you can talk to me and all that. So that's why I was sitting there. I just tried to, have you guys seen that video where we do the MSc thing with the plab videos we have on the YouTube? We watch the video for MSc role play. I remembered that girl. She used to talk to the patient the way the patient was feeling. If that was a maniac patient, she also used to talk very energetically. But if it was a depression patient, so she was talking in a very low tone, and when she was talking just the way the patient was talking. So that's how I talked to the patient. Patient was talking very low. He was feeling very, sad. So I tried to talk with him with the same tone. Although I could not finish my history, while coming out of that station, I was like, I don't know what's going to happen with me, because as soon as I reached the heads, I just asked, with whom do you live? My time was history time was finished. Like my bell rung. It was 6 minutes over. So she told me that 6 minutes are finished. So at that time, I just said, I'm going to ask you one or two more questions, because I wanted to take the organic thing, because I wanted to make sure that I'm also checking the patient is doing fine health wise. I asked for the thyroid, any change in weather preference, and I asked for the drugs. These two extra question which I asked. But I only thing I asked from heads and the house situation, home situation was that, with whom do you live? And that's all. Although I wanted to ask about, he told me that he lives with his father, but because of the time, I could not explore further, so I did not ask how is your relationship with your father or everything. But the people who had this similar station, they told that if when they reached the heads, the person told that his relation with his father is not much good. So that's why I thought that maybe I will fail this station as well. Although the I ticked off the initial his questions, all the questions, but I could not explore the relationship with the father. So that's why I thought maybe they are going to fail me, but I did not fail this station because in approach they gave me 5 approach to the patient, and in history they gave me 4, and in diagnosis again they gave me 5, because in diagnosis I told the anniversary grief, and I also told the 3 more differential. I told about anxiety because the patient was having sleep problem as well, so my differential was anxiety as well, and I told about adjustment disorder and MDD. So that's all about my very first station. That was my first station. After that I got physical examination station. The physical examination station which I got was a cerebellum examination. Unsteady gait was my next station. And in that station there was a very old and the frail lady. It looked like she was struggling a lot with sitting and standing. So I initially asked her for the gait, and I checked for the Romberg sign, and I checked for the tandem gait. So it was positive, like the Romberg sign was positive. So I knew that it is, and she was having broad based gait as well. So only thing I passed, I got 4 physical examination station. Only case I could not pass was this death certificate. I will tell you later that how did I fail that case. But all the remaining stations I passed. um, I was not very happy with my performance, but the only thing I remember is that I was doing running commentary thoroughly throughout. And even when I used to practice with my role player and at my home, I always tried to not skip any point of the running commentary. So that's what I did in the physical examination of all station during my exam as well. And I got very good score in physical examination. So yeah, I checked her for the gait and the Romberg sign. I made her, so because I told you she looked very, it was like she was struggling a lot to sit and stand and everything. So I asked her to sit at that time, but she was not able to. Maybe that's what they told her, but this was my second station, so I couldn't. To be honest, at that time, you just don't understand what's happening. And I was thinking maybe she's doing the role play. Then I was thinking she's very old lady, she's struggling a lot, and I should show some empathy. So I told her, if you want to lie down, you can lie down. I forgot that I have to check the balance in this lady in the lower limb as well. So I made her lie because she was, just having some balance issues. So I told her, you can lie down. But at that moment, I missed that lower limb coordination thing. I asked her for the the shin test that I did for the lower limb, but now I did not want to make her sit again to check for the tap toe test and the finger toe test. So I, while lying her down, I asked her, can you please touch my finger with your toe? She did that, but I thought that I messed this station with this mistake. But somehow the examiner was maybe very sweet. He gave me 3 for the accuracy, but still in my other things, approach to the patient and the the choice of the maneuver and everything, they gave me good score. So that's why maybe I passed. But maybe because of this thing, they my accuracy was marked as 3, because I'm the only mistake which I made was I made her lie down instead of sitting, make her sit down and do the lower limb coordination test. But still I asked her, and then I also asked her to do the dysdiadochokinesia and the rebound phenomenon while lying her down. So these things I asked her for the speech and the nystagmus I also checked. And then because they were literally hiding the the reflex hammer. So I thought they did not give me the reflex hammer. I just missed it when I was done with all my examination. I said that, examiner, if I had the reflex hammer, I would like to check for the pendular knee reflex. And he said, yeah, I have it. And he just brought in the end of the room, and there was a table, and below that table there was a reflex hammer. He brought it for me. And then I had to make the patient sit down to check the pendular knee reflex. Then with the same face, I asked her, can you please sit up for me? I'm really sorry I'm doing this to you, but can you please sit up for me? And I asked her to sit. And then I checked the knee reflex as well. And then because it was, the cerebellar examination, the stem which I had was, the lady was having sensory loss. They gave me the sensory loss in the stem, and they clearly told in the stem that you do not need to do the sensory examination. Just check for the cerebellar examination Yeah, no, the patient did not have. The thing which made me confused was also like they were in when we used to practice with each other, we give everything, all the positive thing with the same disease. I mean, whenever whatever is our physical examination finding relevant, the examiner did not give me much positive finding. He just gave me even that the Romberg sign was also not clearly positive. It was like the lady is able to stand with the open eye, but her gait was broad based gait, and her coordination at some point she showed the problem with the coordination, but most of the tasks she was able to practice, but she was having nystagmus and her speech was also slurred. So these are the two things, and the broad base case with these three findings, her reflex was totally normal. There was no pendular knee reflex. So I told that she is having alcoholic cerebellar degeneration, and because you are also having sensory problem as well, that because of the alcoholic problem. That's all I told in the diagnosis, because as I told you that she did not give me all the positive findings, so even I was that confused at that time that maybe this is not the diagnosis. Well, that was the diagnosis. And next station I had was the death certificate examination. I went inside. There was a mannequin lying on the bed, and the attendant was sitting on the left side. That was the first thing which happened to me for my bad luck. That I went on the left side too, because the lady was crying a lot. There was very old lady who was the wife of the patient, and she was crying a lot. I started, consoling her. She was crying a lot. I like actual crying with tears and using tissue and constantly. So I told her that look, I showed her the empathy and everything, because the main and the first task was also to console the attendant, and then you have to do the death examination. I forgot that I am already sitting on the left side, and the patient was also having the wristband on his left arm. I checked his the ID card, and the wristband the patient was having, and then I just forgot. I stood on the left side and I proceeded with the examination. In the mid of the examination, I realized that I'm standing on the left side. I need to move to the right side, so I moved on the right side. And then I started my examination once again. I did all the steps. I finished all the steps, and I thought that she's going to give me the, because in the previous two station I got uh, you know, the prompt time for the diagnosis and for the physical examination. So in my head, I was thinking maybe I have the time. I'm going to get the prompt time for the documentation. But as soon as I finished the examination, the prompt bell rang, and she was like, you can leave. I thought, okay. So she was like, time is finished. And I could not touch even the death certificate. I couldn't write anything. And at that time she was also hiding the death certificate, because everything is written on the death certificate, so they don't put it there in front of you, so that you can look at the death certificate and start doing everything looking at it. Maybe that's the reason they are hiding the death certificate. But yeah, eventually when the time was finished, that's the time when I asked her for the death certificate. So I left the room. In that station I got four. I got four. In the approach to the patient I got five, and in the accuracy and steps of the procedure I got four. But in documentation I got zero, and I failed the case. And next case I had was, I need to check. Mm. I did not get any case from the counseling cases, usual cases which we have. uh, the only counseling case which I had was, all the counseling cases were from PEDS counseling, and the only new case they introduced this in my exam was the polycythemia vera. But that was a pilot station, maybe because it was very first time, so that's why they made it pilot station. And just give me a moment, guys. I'll open my result because I'm forgetting the stations. If you have any question, you guys can ask.
So did you say that they give you the death certificate at the end of your examination, or maybe if you could have
I was doing. If
asked
I
them
was,
earlier?
yeah,
Because I know one person, she said she was writing it side by side.
no, no, he was.
No?
I should have asked earlier. Maybe she would give me, but I thought that
Yes.
yeah, maybe they will give me the prompt time, because I told in previous two station that was my third station. So I was assuming that maybe
Mhm.
the prompt time once I'll finish the that examination. Whether I don't finish, maybe there is a prompt time and she will give me that certificate. But she was holding it herself. Once I asked, I finished
Yeah,
the
I
exam.
think once we asked them, they give it, because one of my
Oh,
friends, she said she was performing it and writing it side by side.
even that's what I thought at the moment, that I
Yeah,
should ask
because she had exam on same, I think
her.
28 or something, November.
29, maybe
Something. Yeah. Yeah.
was on 20.
Yes.
Yeah.
Yes.
But yeah, that if anyone gets the death certificate
Mhm.
case, please ask them while you enter the
Mm.
exam, have the death certificate.
Um,
And I have
Sana,
one more question in your
Sana, I have
sorry.
done, sorry, I have done the station. I also did it 29th November.
Oh,
So for the first part is, yeah, empathy, then perform procedure, and third part is the death certificate. So, like once you finish the second procedure, you have to come to the table, they will give you. You don't want to ask, but you have to finish that second procedure. Then you have to tell that your patient, sorry to inform you that he's passed away. I legally confirm the death, and I want to write the written document and give you to you. So
oh,
then once you do tell the patients to the bystander, and then you have to come to the table, then only she gave me the paper.
okay, okay. Yeah, that's why na, she was holding it herself. That
Yeah,
I
okay.
finish when she will finish. But the mistakes which I made, I told you that initially I approached the patient from the left side. So at that moment, I had to come to
Mm-hmm.
the right side, and I started this once again because I had to check the pulse and the breathing inspection. All I did, I did it again because at that moment you are nervous as well. Maybe I should skip the things which I did from the left side, but I started doing the examination again. That's why total 8 minutes I was doing the whole examination. All,
Mm-hmm. Mm-hmm.
but that's all I did. I could not document even a single word. Yeah.
Dr. Sana, is the cause of the date mentioned over there?
No, no, no. It's not mentioned. It was the patient was, I think, under palliative care, and that patient expired. Nurse informed me. To be honest, I exactly don't remember few cases, but I think that it was mentioned that he was already there from quite a long time because of he was maybe that he was having some disease earlier, or because not nurse already informed that the patient has expired. Now I have.
Yeah, that scenario is a 15 minutes away. The patient passed away. Mrs. Smith is waiting for you. The nurse called you, confirm the death. So the first task is to say sympathy towards to the patients that you're what you're going to do, to explain to the patient what you're going to do. And
Mm.
second one is the performance of procedure. Third one is the death documentation. In the documentation itself is written its date and MRN number, URN number, name of the patient, date of birth, and there was a 5 rows in that. Then end of that there's a signature and date. There was a form. It's like that.
So we don't have to mention cause of the date. Is that so, doctor?
No, no, no. There was already written in the stem. She was
All
a palliative lung cancer or something. It's a palliative treatment.
Okay, thank you.
So we do not have to write the cause of death. This is what you guys are saying?
Yeah, it was not mentioned. All you had to mention was the steps of examination which we
The
did.
step of examination you have to write that was a no pupillary reflexes and no respiratory effort, no heart sounds, and all 5 signs which we are taking. Then you have to write, I confirm this death in this time and date and time. You have to document and
And
write your name.
okay, and one question, roughly, if you guys can recall, how much time it took you guys to calm the relative and tell her how much time, what you're gonna do?
She was crying throughout. She did not kept quiet for a single second. She was crying throughout, and sometime I was thinking maybe I should talk to her instead of doing the examination. But I
Okay, okay.
literally she was crying throughout, and she was really good actor. It looked like she's the actual attendant. I used to think that I maybe if I'm ignoring her, so maybe they are going to, because we were listening quite from a long time that it is exam of empathy. This year is the empathy exam.
And Sana, one thing, like when you were examining the patient, so you really checked it for 3 minutes, the breath sounds like on counter?
Yeah, I did it. I thought because that's what it's written in my notes that I have to do it.
So for 3 minutes, you kept listening to the heart sound, to the respiratory system.
No, no, not for, yeah, 1.5 minute, 1.5 minute on each side, and the heart sound I only heard on one area. Although it was some other doctor, some other tutor told me that I have to listen all the valvular areas, but I knew that I won't be able to finish it in this much time. So I heard sound I only listened for 1 minute, but breathing sound I put the steps.
And you had the timer with you.
Yeah, it was a clock. I thought it is a stopwatch. I was just constantly trying to start it, and even it was a parent clock which we used to have back in our countries as well. Few Zan alarm and the clocks. That was exactly the same clock it was there, but I just at the pressure of the moment or what, I was just trying to turn it on, and then she was just that examiner. There was a very young girl. लग रहा था मेरे से भी आधी उम्र की है.
Okay. All right.
Just looking at me, she kept on staring me. After I think 30 seconds, she told me, "This is a clock, doctor." अगर वो मुझे थोड़ा पहले बता देती. But she was observing me. Maybe she
Okay, okay,
realized or not. Then she took the clock. Yeah, but the procedure I passed. Only thing she failed me is in the the documentation thing. I got 0 because I could only touch it, not even a single dot I made on that page. So yeah, but
Sorry, Sana. So if we run out of time, can we say that it should be heard the lung in 3 minutes? But because I run out of time, so I can hear it in like 1 minute or 2 minutes. Is it okay?
no, doctor, because it is doable. It is doable in 6 minutes. As I told you that I made a major mistake. I did it from the left side, and then I came back on the right side, and I start doing all the steps again. Maybe I should have skipped all the things which I did on the left side, and I moved further, the right. Whatever was left, I should start doing it from the right side. There would be a chance that they may pass me, but yeah. Otherwise, you can do it. If you calculate it, you can do it because
I would say you are lucky that you started with left side. You know why? I made a mistake. I searched for an identification badge in the right side. I couldn't find it in that much stress. I didn't imagine that would be in a left side. So I missed that. And I asked as an examiner, can I know where's identification badge? I couldn't find it. She said, stick to the task.
Oh.
Then I started with that all task and I got 5, 4 and performance procedure 3 and I got failed that station.
Okay. But yeah, I'm not lucky. Even I failed the station. And this is the
Yeah,
station.
but it is like I'm thinking like if I would have if I see the band, I would pass the station and I got through the exam also. It's like I'm thinking that
Oh, is
certificate.
it
Yeah.
morning or in the evening? Because I
I did with you, Sana. You remember?
person who
Yeah, I did.
asked Dr. Sana. Oh, okay. Yeah.
Yeah.
But this
I got 8 out of 14. The
one
day the
thing.
examination, I got failed. It's like
but that's okay, doctor. Don't give up. If you have got 8, you in the next attempt you are going to smash it with
Yeah,
12.
we'll do it together.
So I just want to ask, please,
Dr.
like,
Sana, I want to
Doctor,
ask one thing.
you
Yeah.
guys are mentioning, sorry, left and right.
I sent the certificate in Telegram group. Is it the same one which Gigi Magic sends?
I'll check.
I sent the certificate in the group. Is it the same certificate or is different?
It is. What's the name of our group? Sorry, guys.
In this clinical recall group, 8 p.m. to 10 p.m.
Yeah, exactly the same.
Oh.
It was
So
exactly
what
the
is,
same.
sorry, I
Thank
just
you.
want to ask you, Sana, regarding the left and the right, you guys are mentioning, you mean the band of the patient was on the left wrist,
Yeah,
like
band was on the left. Yeah.
so that you went to the left. Okay. So now, you pass in the approach, you got 5. And the sequence you pass, they gave you 4, meaning you are doing right, yes? But
Yeah.
the death documentation you fail because you didn't ask examiner, like to the Mrs. Smith, I would like to check the death certificate. Is it with you like that? Then she will give you like that, this paper?
Examiner was having it. She was doing it throughout the examination.
Okay.
And the attendant, she was also, maybe that's, I told you that somehow they are trying to trick you. As I told you about the reflex hammer in the cellular examination, I thought there is no reflex hammer. If they would have to give me reflex hammer, it should be right next to the patient, but it was not there. And I just once I was done with the examination, I was lucky that I was still left with some 1 minute maybe. So I just said to the examiner that if I had the reflex hammer, I would like to check for the pendular knee reflex. Then he was like, yeah, I have it. And then he brought it from me from the end. It was a very big room. Some other Dr. Kristlin also told that, and the last 2 rooms are very big, huge rooms. So that's why they keep these
They
rooms.
keep it in other area, yes.
Yeah.
Okay. So now what you need to write Sana, on this paper, like the death certificate, you need to sign on it and you say there is no sign of like what we have done, inspection, palpation, auscultation, yeah? We need
No,
to document.
doc, sorry, I'm just looking at it now.
Yeah.
It's the shape of the form was like this, like the similar way the lines were written. But now I'm reading it again. There was GCS was also mentioned because I counted the GCS.
Yeah.
I would like to I would have marked that because there is the picture I'm having right now in the group. There is no GCS, right? Or do we
Yeah.
have?
No, nothing.
No, Sana, there is no GCS in that part. First is a name of the patient, date of birth, MRN number, URN number.
Mhm.
And after that, there was a big column. There was like space, and at the end of the part, date and signature.
Okay, then maybe I did not fill it, so that's why I don't clearly remember. But
Yeah, but I
maybe-
have document on that one.
oh, you have document. I did not.
Yeah.
I had
So
it.
sorry,
So,
you passed
the
the
other
document?
doctor,
The other doctors also
doc-
pass or no? Sana,
yeah,
No, I
No,
got the performance procedure because I couldn't find the identification band.
Uh-huh.
Then I asked that examiner, may I know, examiner, I couldn't find the identification band. Then
Which
she
was on the
said,
left?
stick to the task.
Uh-huh. Which
She
was on the
said,
left
stick.
list. Uh-huh.
Yeah,
Okay.
it is a left. With my pressure, I couldn't check in other hand. While I'm writing the death certificate also, I'm searching in the computer. Did I miss anywhere, miss anything? It is in the screen. Then I search for that. In that
Identification of the
time, I
patient.
couldn't get my mind to check the other hand.
Okay, so in death documentation you pass, yes?
Yeah, it's a
Uh,
performance procedure only. I got 3 and I got fail.
But in documentation of the death,
Ye-
you pass because you
Yeah,
wrote
for
no sign of respiration. Yes, you tick. Then no sign of, listen to like inspection, palpation, and auscultation. You just
there
put
is no inspection, doctor. That's you have to check for the pupillary, is a fixed dilated pupils,
Uh-huh.
and you have to check the respiratory efforts, and you have to check the central pulse, and you have to check for a heart sounds.
Uh-huh.
Oh, sorry, doc.
Sorry, there is here. Can you open it in Telegram? Death confirmation. There is assessment. Number 1, identification confirmed as. Okay, Frank.
Nothing is written in there. You have to write yourself. So this one is so I normally in our hospital we are doing this was like no respiratory effort, no response to verbal stimuli. There is no supraorbital pressure, no central pulse, no fixed dilator, and no heart sounds, no breathing sounds.
Okay, and you
Then
signed.
I wrote as the death confirmed by me in this time along with the next to the wife. So you have to return that was a nurse has called me to confirm the death on this time. Then I started that sentence and I document all these 5 points. Then end of the time, I confirm this Mr. Smith has passed away on this time. I'm confirming this on this time.
Okay, and you sign and you put the date and time. Okay. So
Time,
what
yeah.
you wrote on the paper? So no no respiration. You wrote there because Sana mentioned Glasgow Coma Scale. We put 3. We do death certificate also from here.
Yeah,
But
because
the Glasgow.
the
Where is
video I have seen and the tutor class which I took Dr. Amir's physical examination, he specifically mentioned that we have to check GCS.
GCS, yeah.
Uh,
But not necessarily in this case. So just now, like people reflex absent, I listen to the heart, to the chest, to the lung, for heart for 2 minutes and lung for 3 minutes, totally 5 minutes, nothing.
Dr. Sana, did you guys check gag reflex and corneal reflex as well?
no, I just mentioned I would like to check gag reflex and the cornea reflex because by the time I realized I'm going to run out of time, and it was already a mannequin. What was the point of checking the reflexes?
Yeah. You just mentioned, and also the pupillary reflex you mentioned, or you did it?
Now pupillary, because the patient's eyes were open, the mannequin's eye, right, doc? I can't clearly remember, maybe, but I did proper.
No, there's a torchlight is next to that. Torchlight. It was every equipment is next to that, so you have to do.
Yeah, I checked.
Whatever is there.
Now I'm looking, doc. Doc, may I know your name? Sorry.
Turka. Aaron.
Now I'm looking at my, the assessment card. It says that the criteria of marking is choice and technique of examination, organization and sequence. बेटे बाबा पास जाओ. अजर इसको बुला लो यार. And performance of procedure and approach to the patient. There are 3 criteria. In choice of technique and examination and organization, I got 4. And in performance of procedure, I got 0. That's what maybe the documentation part. And then approach to the patient, I got 5. But the predominant assessment is the performance of procedure. Yeah. So
That's
that's all.
what I got
Doctor,
3.
I forgot your name. Did you also check respiratory for 3 minutes and heart for 3 minutes, or we should check heart for 1 minute?
Myself.
Yeah.
Yeah, I wait for because it's that the guideline says you have to check for 3 minutes, 1.5 minutes, 1.5 minutes. So I take on time and take very slowly. I did. I
Mhm.
don't know the time because when we are inside, we don't know the time appropriately how it's going. So I didn't know that there was a watch is there, but I did it very slowly. I did it very slowly. I don't know how, but I spent a lot of time with the procedure.
Okay.
Did you mention about that I have to look for the 3 minute and 1 minute?
No, I didn't mention. That was I'm checking this respiratory effort. So I put all this on. Then was like the examiner's the face was very rude and was like she was don't care about us. It was
No,
like
Doc, I think we need to mention the timing because the examiner is not looking at the clock. She doesn't know how long. Whether we check or not, we have to clearly mention the time that for this long I'm going to check the heart rate. For this long I'm checking the pulse. This thing is 100% that you have to do the running commentary throughout. Whatever you are doing, whatever you have in your head, whether you perform or not, you have to keep on telling the examiner because maybe everyone says that, but I did not sense this thing that examiner can also zone out. I thought they are 100% there, they are not zoning out, but maybe sometimes they do zone out. So at least you have to constantly talking that they are at least listening to you, not properly looking at you. So this thing, whoever gets the exam, the same examiner, whatever is your physical examination, just keep on telling everything whatever you are doing.
yeah,
Yeah,
Sana, my
because
one is
Dr. Sana, I'm
yeah,
thinking like 1 minute we have to do the carotid, 1 minute we have to do the heart, and 3 minutes for that. It totally makes 5 minutes. So even if we are doing 1 minute for each, we should just mention that I would like to check for 3 minutes, but due to shortage of time, I am doing for 1 minute.
No.
If because
The
you
reason-
told that you didn't get the timer and you couldn't do the documentation maybe. So that could happen that we should also tell just and do not do it for 3 minutes.
Yeah, but I checked 1.5 minute on each side. I listened to the heart sound for only 1 minute, and yeah, but I'm thinking that because of the left side, but I missed the time. But that could also be assuming the whole time. So yeah, I think this case I never practiced on anyone. This maybe that's also the reason I did. Other cases we do the role play, the physical exam. At least we are doing out in our household at least, and on some the kids try as well. But this is the only case, that examination case, I never ever practiced, considering it is a very easy case. But it when I practiced it, I just messed it up. So I think we should practice every case at least once, so that we have the idea that what is going to be the time management in that case. Yeah. Well, moving to the next case, because already 6. Next case which I got was, okay, I'm not remembering the sequence now. The next case which I had was incopresis. In incopresis case, there was a father who was very fidgety, who was very anxious. Right, doc? Okay, you remember the father was very anxious. It looked like initially I thought that maybe he's some addict and they just asked some addict to sit.
Yeah.
He was constantly fidgety, but he was throughout the history he was constantly saying whatever you are going to ask from that father, he was constantly saying that my son is very shy, my son is very shy. I asked him, what do you want now? Okay, so I took the whole history in detail. Sorry doctor, I need just 1 second. According to me, it was very good. These are the only 2-3 cases which I was 100% satisfied that I asked everything from the history. But when I came after exam, I saw the feedback from the same exam. So someone was writing that he was saying that my son is very shy. He does not use the school toilet. This thing I asked her, what do you mean by shy? He was like, he's very shy, but I should have explored, does he use the public toilet or something? But I did not ask clearly this question. But when someone asked him this question, that person, he gave the proper answer that yes, he does not go to the public toilet and the school toilet. But otherwise I asked everything in the history, whatever we have in our structure. So I asked everything. And then in the counseling I also told him that, because I told you that he was very anxious, so I was constantly asking him that is there anything wrong with you? Like maybe you and your wife is, because that was a male, there was a father inside, so maybe you or your wife are not, coping up with this condition your son is having because of constantly soiled clothing. But he was like, no, no, we are okay with it. We are okay with it. Maybe that's the thing that I could not explore this part. That what do you mean by shy? But maybe he does not use the toilet or something. But he was throughout he was very anxious. But I did the whole counseling part as well. That I told him that because of the constipation, he told that he has constipation. He's regular, his the he never checked. He's they don't know when he is inside the toilet, but they know this thing that he has constipation from quite a long time. So that thing I mentioned, that maybe and he also mentioned that he does not eat the fruits, and he does not drink much. He eats the outside food. He eats burgers and pizzas. This is the kind of food he usually prefers. So that's why in my counseling I also emphasized on his food as well. And I told him that you need to make him sit in the toilet yourself after every meal, and all those points which we have in our counseling. I told him all these points. And in this station I got 5, 5, 5 and 5 in all the things. So
Mhm.
Did you mention, doctor, any anema, something like that in the management?
I did not mention anema, but maybe I mentioned, to be honest, guys, actually, yeah, now I remember, management was not there. Only counseling was there. Management, maybe the specific, Dr. Turkey, do you remember? I think it was clearly written, no management.
It is a history and diagnosis, and
Yeah, maybe just
yeah.
but still I mentioned few counseling points that don't, because I told
Yeah.
very anxious. So that's why maybe, yeah, it was whole history and it was diagnosis. Management was not there, but still I got to, because in cooperative there was not much differentials. I just told him the diagnosis, but after that I also mentioned few counseling points as well. I told him because my history was finished. So I asked the examiner, can I move to the diagnosis? So he was like, yeah, you can. So I started telling him diagnosis maybe 1 minute earlier. And so I mentioned the diagnosis, and I also told him that because he is having constipation. So I told that because of the constipation there is the buildup of the stool inside. And because I got the physical examination as well. In the physical examination there was a mass as well, because of the constant chronic constipation, they get the mass in the left side of the lower abdomen. So that's why I also mentioned that his constipation is very chronic. That is why we can also feel the mass is there, which is basically the bulked up stool. That I also mentioned that this means that he needs a proper attention regarding his food and regarding his constipation. That's all I mentioned in the after diagnosis. I mentioned these things. And yeah, that was all about this station. And yeah, I got good, I think.
Sorry, we are discussing about management, Sana. If there is management, they ask you, do you do email or just like that? This is our, yeah.
Yeah, I told you that it was not the management, maybe because management was not there at all, because I did not mention enema.
Yes, no, I mean, sorry, we ask you now. If there is management now, do you do enema or just like that?
No, we do enema.
We do, yes? Okay, thank you.
Yeah. At that time, maybe I started telling him the management thing. As I told you, that attendant was very fidgety. He was very anxious. He was just looking down, and he was sometime, just putting his fingers, tapping his finger on his forehead. Maybe that he was giving me some hint or something, but I was constantly asking him, can you tell me how are you feeling? That's how I started asking. So that's why I also mentioned that maybe I should mention a little bit about the management, that there is nothing much about his management. We just need to focus on his diet and everything, and he will be fine soon. That's what I told him in the management, in the diagnosis part as well. Yeah. So that's all about this case. And next case I got was the vaginal lump. The vaginal lump case was that typical vaginal wall prolapse case. The only thing is that I did not ask the surgery at that time. I somehow missed the surgery part. But once I finished all remaining points, all whatever I have in my notes, I asked. The only point I asked about the job. I asked about chronic constipation. She also told me that she had three vaginal deliveries, no history of big size baby and everything. And she was working as a librarian. That was her job. And she told that she has to hold the heavy books and take them to the these things she mentioned. So I thought that maybe she has the 3 or maybe 4 she got the SPDs. These are the reason for the vaginal prolapse. But when I came to the diagnosis, then at that time I also asked that I need to ask you one more question. Do you have any surgery on your stomach or on your down below in your private part? So then she told me, yeah, I have they removed my womb because of some problem in my womb. So so at that time I also mentioned that I asked her immediately that, did you do the Kegel exercise? Did your doctor told you any exercises? She was like, yeah, they told me, but I did not do because of the pain. So yeah, that although I could not ask it in the history, but in the diagnosis time I asked her this specific question that about did you have any surgery, and then I told her that okay, so you are having a condition called vaginal wall prolapse. And yeah, that's all. It was also the diagnosis. So in this case, in history I got 4, in choice of technique organization I got 5, and history I got 5, choice of technician technique and everything I got 4, and diagnosis and differentials diagnosis I got 5, and approach to the patient I got 4. I told
Okay, Dr. Sana, when you ask the question, whenever you ask question during diagnosis or differential, did the examiner stop you or not?
No, they did not stop me, to be honest. And these 2 stations I asked, this station as I told, and in the psych station, in these 2 stations,
Yeah, grief disorder.
time.
Mhm.
They were very kind on me, but they did not fail
And
me.
they didn't give you PFE in this one, right?
I
Vaginal wall.
there was no PFE.
PP is there, right?
PFE was there. To be honest, my memory is very bad. I don't clear it.
Because if they give PFE, then in PFE they can mention like hysterectomy has been done and there is no uterus. But if the PFE was
Right,
not.
Yeah, PFE was there. PFE, when we asked the patient, he said it's a vaginal lump is there. It is reducible. Yeah.
Ask physical examination, because I was thinking to ask the Valsalva maneuver, but he on the instant asking, he just gave me all the finding. I did not get into much maneuvers or anything, and there was the leaking of urine as well. So I told her in the diagnosis, I also told her that because the exercises down below and the surgery, and because of the the deliveries you had and the long time standing, you have also the weakness in the the pelvic floor muscles, and also that is the reason you're having leaking of urine as well. And few differentials I also mentioned that I thought it is some hernia, but it is not, and few other points I told few differentials as well in the diagnosis. So that's why they gave me maybe 5, because in 2-3 I could not, in PFE I did not tell the differentials, I only told diagnosis. So I was thinking that maybe they are going to judge me for it, but they did not. Only with diagnosis they passed me. But here I mentioned 2-3 differentials as I remember. I was thinking about, I told them that I was thinking about carbuncle or folliculitis in your private part, that is huge inside, or Bartholin gland lump. These 2-3 differentials I mentioned in this case. Yeah, and then I got examination. In the thyroid neck examination, every station you people are going to do some blunders, but as in this station, the lady was just covering herself thoroughly. She was wearing some stoller in her neck. She was wearing full sleeves, and she was just covering herself. So as soon as I started the examination, I wanted to check. I checked the tremors and everything on the inspection in the hands. I did check the palms. In this examination, in all the physical examination, I mentioned that I am looking for, because I was expecting that maybe they are going to give me some finding, but they did not. She did not give me any tremor. And in the palms, I mentioned that I'm looking for any sweaty palms, or I'm looking for any cold clammy hands, but I don't have any. Then I checked the pulse. I'm looking for the pulse. I'm looking for the volume, but the examiner did not give me any finding. Then I checked for the reflex. Reflex was also normal. There was no hyperreflexia. And then I moved up. I also checked the lymph nodes. And then I started doing the neck examination, the lump thing. All we had the inspection and the angle and the the water sip and everything. I remember this thing, because in throughout the examination I was not facing the examiner. My back was toward the examiner, so I was not looking at him. But once for the palpation, I moved from the back. I think he was just also checking this thing, that how do I do the palpation. So at that time I saw him taking touching the tab. Maybe this is something they were also looking, whether we do it the palpation from the front or back. Then I also checked the cervical lymph node. At that moment, I also saw him taking the tab, and so I did the palpation. I checked the lymph nodes, and After that, I also, before moving to the neck, I also checked her eyes for the lid lag and retraction and eye movement and periorbital mixed edema. I did all. Yeah, I was all the time. I was asking examiner, can I expose her arm? As I told you that she was, covering her whole arm. So I, for the reflex, bicep reflex, I asked examiner, can I expose her arm? So examiner was, bit offended. He was like, you need to ask it from the patient. So I looked at the patient and she was smiling. She was like, yeah, doctor, I can expose it for you. I was like, okay, then. Then I removed her, sleeves. And then and then when I told you that she was having some stroller around her neck, some scarf around her neck. I was like, examiner, can I expose her neck? Again, examiner was like, you have to ask it from the patient. And I did the face examination, neck examination, and then I wanted to check the peritibial mixed edema. At that time, I was looking at that lady that I was like, can I expose your leg? I want to check for the, the edema around your legs. At that time, she was looking at examiner. And then examiner was like, no, you can skip it. At that time, I was like, now I need to ask it from you. Otherwise, you are saying like talk to the patient. But there are a few confusing points that sometimes examiner is going to give you the finding. But throughout, I did not say I don't have anything. All the exam throughout the examination, I was saying I am looking for this. I'm looking for any, the enlarged lymph nodes, or I'm looking for any enlarged gland. And I was doing the running commentary. I'm checking the, the left lobe of the thyroid gland, isthmus, and I'm checking for any, the surface and consistency, and I'm checking for the lower border. He did not give me any finding. But once I was done with the examination, he gave me a picture. It was a very, very, very big mass picture I got. So I was like, that how he's not giving me any finding while I'm doing the examination, and I'm constantly asking that I'm looking for this. I just, because while doing the role play and while taking the physical examination classes, we just came to know that they will give us some finding during the examination that is going to help us for the, the diagnosis thing. But they did not give me any finding because I could not get any finding. So while even looking at the picture of the gland, I could not diagnose much except the multinodular goiter. That's the only diagnosis, because I could not even judge whether it is hypothyroid or hyperthyroid because I did not have any finding. So that's all I told, that it is an enlarged lymph, the gland. And it at that I did not ask Pemberton sign previously because my bell was rung the prompt time I got for the diagnosis. But once I look at the enlarged gland, then I said that I would also like to check the Pemberton sign because of the enlarged thyroid gland. So I told her that, can you please raise your both arms? So she raised her both arms, and I mentioned that, examiner, I'm looking for the Pemberton sign and it's not there. So I told her about only multinodular goiter, but I also mentioned that I was also thinking about Graves' disease, but for that I need to check for, the antibodies. I'm going to do for the blood test in you to make sure, and the thyroid level for the antibodies, that few things I mentioned, because I was not sure about the diagnosis. But still, in this station I got 6 for the choice of technique and examination, and accuracy of the examination I got 6, and diagnosis I got 5, and approach to the patient, luckily he gave me 4. Otherwise I was thinking maybe he will fail me in approach to the patient, but he gave me 4. But for all the remaining things he gave me 6 and 5.
Okay, so Dr. Sana, what was the stem that you didn't get an idea about the stem that it was
No,
hyperthyroidism with hypo?
no, nothing. It was just the lady is waiting inside and she's complaining about some lump in her neck. That's all given in the stem. And you perform
And maybe they were giving some cold intolerance. That's
Not,
why she was covering herself.
yeah, but I told you, that
Yeah.
checking, I asked her for this thing. I checked her reflex. I asked while touching her palm.
But they didn't give you any other positive finding except that she was wearing a lot of clothes.
She was only wearing, full sleeves, but that is not the only thing. That even she did not. Although I did not have the history, so just on the basis of clothes, I told, because it was not like she was wearing some heavy clothes. She was wearing sleeves only. The extra sleeves which we have to get. That kind of sleeves she was only wearing, and she was hiding her neck with just the stroller. Nothing else. She was not wearing any, the sweater.
And boots also. She was boots with leggings.
Yeah, she was.
The whole leg was covered. Yeah.
And
so
plus,
I think they put me like to misinterpret it. Like everyone, we go with the hypothyroidism, but it is normally we have to do all the thyroid examination.
Yeah, and hyper. The Melbourne weather outside people also are always wearing something like this because there is weather a little bit cold. So that's why I thought maybe that's from her home. So I cannot say that she's not dressed appropriately. according to the weather. So that's why I did not say, to be honest. This thing I did not mention, that she's not dressed appropriately, because outside everyone was having the similar dressing. So I thought that maybe that's how she is also dressed up.
So you didn't mention hyper, you just mentioned that it is a multinodular goiter.
Yeah, because I told you that throughout the examination, I did not say that I don't have this, because I was expecting to get some finding. So I was asking examiner, I'm looking for hypo or hyperreflexia, I'm looking for the sweat or cold and clammy hands, I'm looking for any low volume pulse or tachycardia, but I'm looking for. I did not even say I don't have, because I was expecting maybe at some point he will say you have this, because in cerebellar examination they gave me some findings. So that's why I was expecting that in this examination they will also give me some finding. But throughout he was just standing there silently. In the end, he just gave me that huge lump picture, and at that time only thing I had in my mind as a possible diagnosis was nodular goiter, MNG. And then I said that it could be Graves or anything else, but that I can't comment before doing the further blood tests. Yeah.
And all of the other candidates also mentioned the same, or did anyone else mention hypo and they also asked that?
No,
I did same as Sana. This whatever I did is the same as Sana. I just, when I asked the peritoneal myxedema, that patient look at the examiner, then he said skip. Then he gave me the end of the session only show. That's the same method I did. But whoever does is a hypo, the wearing that those got failed on that exam. So one of my friends, she commented about the hypothyroidism.
Oh, they failed her.
Yeah, therefore she got failed.
Oh. Okay.
Yeah. And then next case I had was chest pain. The chest pain was the clear-cut pericarditis case. It was that there is a lady waiting inside and she's having chest pain, and your task is take history, ask explain ECG, ask physical examination. Now in physical examination, after that they will give you ECG that you have to explain, and after that you are doing the telling the diagnosis. So in this case, and did we have the management doc?
No, that was a ECG.
We don't get any. We did because I had the similar case in some role play, so I'm just maybe mixing up with it. Beta.
No,
Yeah, we did not.
pericarditis, the one is history, and other one is the examiner give the ECG findings, and we need to ask from the PFI. Then we have to explain to her, to the management.
Okay. So yeah, so no. In this case, I think we don't have the management, or yeah, we had
diagnosis and
no, we did not have the management. We had explained the give the possible investigation and explain it or something like that, and then for the
explain to the
investigation
explain to the patient, because I told her that 3 weeks back you have this respiratory tract infection that will be possible cause to pericarditis. So I remember that I have answered like that. I got through that one also. Yeah.
Okay. But I think I mentioned this thing that we are going to give you NSAID for the treatment. Only thing I missed in this term, I knew this thing clearly, that whether it is a clear-cut pericarditis, I still need to order trop I, but I forget. I did not mention in the exam, to be honest. I did not say this thing. I somehow missed it, although I knew this case. I got this case from that we used to do the Dr. Pascal role plays. In some class he gave me this pericarditis case, and he clearly told me that you have to still order the trop I, but I did not order the trop I got the clear-cut ECG in the exam, that same pericarditis, the gross ST elevation thing. So that I got, and I also mentioned that you are having pericarditis because you had the history of flu-like illness, which is basically a viral disease. And these things I mentioned. So in this case, I got 1, 5, and on remaining 4. In approach to the patient, he only gave me 4, 5, and in remaining things he gave me 4. And now I realize that's why he gave me 4, because I did not order trop I.
Okay.
Yeah, if we get the case, we have to still order the trop I.
Sana, did you mention the ECG to the examiner or to the patient?
No, examiner.
Examiner. Okay, all right.
Okay.
And you just have to tell the rate, rhythm.
Yeah. All that I'm looking at the rate, I'm looking at the rhythm, I'm looking at the P wave, I'm looking at the PR interval and the QRS. That's all. And then in the end, I said that I'm looking for any ST elevation. And then, but wherever I found the ST elevation, I told examiner that I found ST elevation here, and here.
And it was a management also?
I think it was not the management, but I still told the patient, because she looked very anxious again. So I told her
It
that
is history, choice and technique and interpretation of investigation, diagnosis and differential diagnosis, because the marking scheme, it
yeah,
says
yeah,
5 parts. Yeah.
yeah. So maybe interpretation of investigation is basically ECG.
Okay, and
Yeah, that
other
is the
than that,
ECG. Yeah.
other than ECG, do you have to physically examine the patient as well? Like you have to ask physical examination findings or not?
Yeah,
Yeah.
from the examiner, we need to ask from that what are the all this pericardial drop and all those stuff.
Mm-hmm. Everything.
Okay, thank you.
Yeah. And then I got the abdominal pain case, which was the worst case according to me in the whole exam. It was a very big stem. It was a very big stem outside. They told all the physical examination and the history. Azhar. So it was a whole history given. I could not, to be honest, finish the whole stem outside. So after 2 minutes, I went inside and again I told examiner that I could not read the whole stem outside, so I need to read it again. So he was like, yeah, it's okay, you can take your time. So I read the stem once again, and even after reading the second time, I missed in the stem that it was written that the patient does not smoke but patient drinks. I thought the patient does not smoke and patient does not drink. That's how I read it, even after reading it second time. So it was the whole history was given. The history was biliary colic history, that the lady had pain in the upper epigastrium and she came in the ED, and we gave her painkiller. Her pain is settled now. Investigations are given. In investigation, LFT was given. Amylase was given. Lipase was not given. And CBC was given. That was the purpose of the case. CBC was totally fine. So now you realize they wanted to confuse us between cholecystitis and biliary colic. Now, if it was cholecystitis, her CBC was not fine, whether it was even pancreatitis or any kind of infection. So that's why they clearly gave us CBC is normal. And I knew it's not an infection, but still, instead of saying cholestasis, I said it's cholecystitis. So I failed this case. But and they also said that what further management you would do. So I told her that I am going to do your ultrasound to check the stone, and then we may consider any other investigations as well, ERCP or something. But to be honest, I still could not, because I did not read it properly, so I did not perform it well. At that moment, I knew that I have failed this station, and I really failed this station. So, Dr. Turkey, if you have passed, then can you
Sorry,
please?
it was biliary colic.
It
I
was
also failed, but I couldn't because I told there was a biliary colic. The different diagnosis and differential diagnosis he put 2, and all the other domains is 4. So but I remember, because when I start to differential diagnosis, I start is a biliary colic and it could be gallstones. I will ask you to repeat the full blood count and LFT 2 weeks in time. In the meantime, I will arrange for ultrasound abdomen to review with your GP.
Doctor, that you're going to check serum lipase as well, because only amylase was given.
There was whatever the scenario it says is all the investigation is normal, right? Troponin, full blood count, LFT, everything is normal.
Was
So
written.
the
only thing
question is, what is your professional diagnosis and differential diagnosis? What you want to discharge the patient. You are going to discharge the patient. Before going to discharge, what is your advice to the patient?
It was
That
what
is the question.
investigation you also need to do, because investigations was asked, and even in the, and I'm looking at the scoring, there is a part of investigation as well, choice of investigation. I clearly, and in choice of investigation I got 4, and
I also got 4.
but I said as soon, just a minute.
Guys, I just would like to ask to tell you, please, we solved this recall with our tutors, okay? We did a course with HEAL, okay? So HEAL tutors are fellowship doctors here, okay? And the GP. So this is like biliary colic, differential, and PUD. That was the recall, PUD. Peptic ulcer disease, okay? That was the patient, everything was normal, and she is about to discharge from the hospital. Speak to the patient, tell her the management and what you need to do. So it was colic with, and she was a history of cholelithiasis. She has a stone, but the wall was not inflamed. Yes, that is the recall. The ultrasound was given to you, and the thickness of the wall was not. Some
No,
people
for our question, ultrasound abdomen is not given.
not given. Yeah, for you guys, you didn't get it, but for other candidate, they got the ultrasound in different day. But at the end of the day, we solve it with our tutors. So they told this is one recall. It is named biliary colic with PUD. That was the answer. And sorry, Sana, regarding the neck lump, did you mention only the hyperthyroidism? You didn't mention the differential is hypo?
I did not
Because
say any in hyper or hypo. I only told that it is multinodular goiter. I did not use any word hypo or hyper. I said that because of the enlarged neck, I said that I was thinking about Graves' disease, but for that I need to check. I
what
did.
was the history, Sana? What was neck lump? Yeah,
No history,
55 with
doctor.
neck lump.
It was only neck lump. My task was perform physical examination and tell the
So when
diagnosis.
you did because I got in my exam thyroid neck lump, I got 5. I passed this recall. I did hyper. I did like EMEA.
I mentioned both points. I mentioned
I mentioned both point, and in differential I mentioned 7. Hyper. I thought could be hyper Graves like you. MNGS, multinodular goiter. I thought the Graves multinodular could be hypothyroidism. I ruled out Hashimoto. I thought like that. Inflammatory cancer. I even mentioned thyroglossal cyst. I ruled out and lymph node. I tell 7.
I mentioned about thyroglossal duct and cyst, not in the differential, but I said that can you please stick out your tongue, and
I did that. I did also
I
that.
did this thing and I passed this station. To be honest, but he did not give me any finding. I was mentioning whatever I was doing. I was constantly telling him that this.
I was telling also the same. I got it in my exam, and
But
I
did
got
he give you any finding, doc?
no,
They-
nothing. So now the same like you. They give me photo, multinodular goiter, exactly what they gave you, the same. But
Okay.
in my differential, I give 7. I follow Ania exactly. And now I start with hyper from so I ask, okay, Jenny, I will start now. I'm looking for the sign of hyper. I did all hyper, okay. Then I did all hypo, especially but inspection, palpation, percussion, auscultation, the same for both. And I did a 3 PR, pemfertin, retibial mesothelioma, and Amir, this one. We follow Amir. And I give 7 differential. But when even I saw MNG, which is multinodular goiter, I stick to my structure. I thought it could be hypo, unless I did the thyroid function test to check TS thyroid stimulating hormone, and I checked T3, T4, and antibody. And
I
examiner, he told me.
But I said that I need to check your thyroid function test.
Yeah, I thought like exactly. But when differential, I mentioned both hyper. In examination, I mentioned both hyper. And lymph node, I also tell. I thyroglossal cyst, I did 7 differential malignancy, ended up with malignancy.
Yeah, I mentioned malignancy in my differentials as well. Yeah, but I did not mention Hashimoto. I mentioned Graves. I mentioned cancer. Yeah, that's
You didn't mention the word hypo. You just mentioned the hyper because you saw MNG. Yes, like that.
I did not say hyper. I did not say hypo. I did not say hyper. I said that and I need to check your thyroid function test to check your level of thyroid. Whether I did not use this word hypo or hyper. I just say MNG, Graves, and I just said that it could be cancer, but I need to do further investigation. I need to consider. Yeah.
Yes, no worries.
Sana, just
also this
for abdominal pain case, can you tell me the positive findings? What were there? Like in the time, what they have mentioned?
They mentioned that lady came with pain, upper epigastric pain. She has family history of cystitis. Cholecystitis, gallstone. Her mother had the
gallstone. Biliary colic.
And it mentioned that she does not smoke, but she drinks regularly, daily 4 glasses of wine every day. And yeah, I think to be honest, it was a very big history. If Dr. Turkey remember, mine is very bad.
Okay.
They say it is a right upper quadrant pain. Now that after all the investigation, they've mentioned it's LFT, full blood count, that was normal. The patient is ready for discharge. Give me take the history and give the professional diagnosis and tell the patient what you're going to do next.
So you made the diagnosis of biliary colic, and how much you got marks in that?
I got all 4. I got through that one.
Yeah, okay. So that was for the biliary colic. And what investigations did you mention? Can you please
I mentioned because I remember
right?
this recall is a biliary colic that you have to repeat after 2 weeks with all the full blood count, LFT, lipase, and ultrasound. In the meantime, I will arrange for you ultrasound and abdomen. I will ask your GP to review after 2 weeks in time. This
Okay.
is this is
And did
what
you
I
mention for
mentioned.
any plan for cholecystectomy or anything? Because we plan for if the patient have this recurrent bilichoric and we plan for cholecystectomy. Did you mention anything like that?
Pardon, what you asking?
Like, did you mention for any if the patient present with the recurrent biliary colic, then we plan for cholecystectomy, right? So did you mention for that?
No, I didn't mention about, because we, like, could be a differential diagnosis, right? Biliary colic or gallstone. We don't know what it is in the right upper quadrant pain. Now it's a pain resolved. Patient ready for discharge. Give me your diagnosis and what you're going to be. Like, what is the question, Sanam? What what is a nice word was there? What is the
What is that? Sorry, Turkey, what do you want?
what is the question is written in there, Sanam? The third one.
Scenario. And she has a history of cholelithiasis and and some recall mentioned the inflamed wall. So what she gave you a positive things. She is taking NSAID for arthritis. That was positive in this case. Plus the right upper right upper pain. So we solve it with our tutor. Our tutor, what they told us, they told us this is yes, biliary colic. Yeah, the same like what you
Yes,
mentioned now.
Zainab, I agree with your scenario, but your scenario is mention your ultrasound abdomen. So you can talk about this. Our scenario, they didn't mention about the ultrasound abdomen.
So how you know there is a stone Turka here? How you know?
That's what I said. They say it's a give you a provisional diagnosis and differential diagnosis. So you have to mention it could be biliary colic, it could be gallstone, it could be liver hepatitis, it could be
I mean, it was not
myocardial infection.
mentioned.
I have
Okay.
mentioned all the differential diagnoses.
No, I mean she was admitted for the hospital for right hypochondrial pain, like that. Yeah.
She admitted to the ED with a right upper quadrant pain. So
No,
after
no,
pain
it was
management, they have this pain resolved.
yeah.
And all the
Nice.
investigative request form of ultrasound abdomen. So your GP will follow.
Remaining station, then I have to go because my daughter, she's very fussy right now. Another case I got was the croup case. It was the stem was given outside with history and the physical examination. All the physical examination finding was given like the severe croup findings, like the baby was having a tracheal tug, he was having intercostal recession, he was very irritable, and SpO2 was also dropped. It was, I think, 92. All the findings were given. My task was to tell diagnosis, and I explained the physical examination finding to the father, because the father was sitting inside, and tell the management. That's all. But later on, I came to realize, because it was an 8-minute station, I went inside maybe in 5 minutes or maybe 5.5 minutes. I finished all my case. I did not do much counseling. I told I explained the physical examination finding, like, look, he's using all his respiratory breathing muscles, and we can see that there is depression in between in his ribs, which we call as intercostal recession. I told him that he is lethargic and he's irritable, which is also pointing toward the severe infection. His oxygen level is also dropping, which is again suggesting toward severe infection. All these explanation, physical examination findings, I explained to the father, and he looked very fussy, and not fussy, but he was a bit, he seemed distressed. So I told him that don't worry, I understand that small child, if he gets sick, the parents feel very bad, but he will be fine because you are sitting in the emergency department. We'll be taking care of your son throughout. And I told him about the whatever we have, the RCH guideline management, that we will nebulize him with the adrenaline, and we will give him 2 days of steroid. And if he's here, and although we are giving him oxygen, but if his oxygen saturation drops, if his struggle with breathing becomes worse, we can consider him for intubation as well, because you are in the hospital emergency department. So these are all things I told him that. And I also mentioned that pediatrician will be there, he will be reviewing your child. That's all I mentioned, and I was totally out of words. I did not know what to tell further. I could not produce much. So I just for 5 minutes I kept on talking, and then I kept quiet. For the remaining 3 minutes I was sitting quiet inside, and I asked the father, would you like to have a glass of water? He was like, no. At that time I was feeling very low, very bad. This is the station which I got, I think, after some very bad station. So I really needed water. So I poured water for myself, and I drank water sitting inside the examination room. But I was feeling very bad. So I took water, and I thought that I'm not going to pass this station because I did not follow the ethics. I was drinking water while sitting in the examination room, but they did not fail me for this case. They gave me 4, 5, and 4, like 4 for the patient counseling and education, for management they gave me 5, and for approach to the patient they gave me 4. So that's what I say, that if you mention the key point, this is the only thing they want to listen from you, nothing extra. And I also mentioned that once you are discharged, you have to visit your GP as well for the vaccination. I did not mention the RSV or influenza vaccination, but I said that the regular follow up with the GP you have to go for. That's all I mentioned in the counseling, but I could not produce much at that time. I thought it's only management, but later on I realized that it was also a counseling case. Yeah. And next case, I got testicular lump, the typical testicular case. I went inside. The role player was, as soon as I entered the room, I knew that I need to mention the stop sign signal. I need to tell about the chaperone. I need to tell about all the things we mentioned about the sensitivity of the examination. But as soon as I entered inside, I was doing my wipe. The role player was like, "You want me to expose? You want me to expose?" And I was like, oh, he was just forcing me, and I was like, yeah, you can. I did not mention chaperone, and I did not do this stops. I did not tell him about the stop signal as well. And I started the examination. I did very good. So that at that in this examination, I was very sure that okay, I will pass this station. And I told about the diagnosis and differential. I also told him that it was because the cremostatic reflex was normal. The Prehan sign was positive, so it was clearly an infection. And so I told him, but still, I would. And that thing was negative. The trans elimination test was negative in that case. So I
Okay, you can
yeah,
finish.
yeah. So in the diagnosis, I mentioned that it is an infection, but I'm also thinking about cancer. So that's why we are going to do ultrasound in you, and we are going to check the STS screening. I'm also going to do whether although the investigation was not asked, the management was not asked, but still in the different, as I was telling the diagnosis. So while telling the differential, I also mentioned that I'm going to do the further investigation to rule out cancer. And as you have this infection, epididymoarthritis, so I'm also thinking about sexually transmitted infections. So with your consent, I will also screen you for the sexually transmitted infections as well. And tumor markers I also mentioned. So I got, in this case, choice of technique and sequence, I got 5. Accuracy, I got 5. Diagnosis and differentials, I got 5. And in approach, they also gave me 5. Although I was thinking that maybe they will fail me, I did not mention chaperone. All the time I was thinking about this station, I was like, oh, I did very good, but I did not mention chaperone. Maybe they will fail me, but they did not fail me for this station. And
Okay, Dr. Sana,
Okay.
when the role player was saying like what he wanted to expose, like he was saying that do you want to give exposure of that mannequin? Was he saying?
he was sitting beside the mannequin. Mannequin was covered with a white sheet. And as
Mhm.
I told you, as soon as I entered, I was just doing my wipe. In the beginning of the wipe, he was like, "Yeah, I can expose it for you. I can expose it for you." Maybe they were giving us some time or what, but he did not give me proper time to do the wipe thing. But we have all this confusion in our mind. They are just tricking us to fail us. So I was thinking maybe that's why he was
Mm-hmm.
expose that whether I forget the chaperone or not. This is what I was thinking. But no, they did not fail me for the chaperone thing.
Okay.
Yeah,
That's
yeah.
good.
And I got that I previously mentioned HSV case, the vulvar lesion case. The task was perform history. I took history. In history I got 4. In diagnosis I got 4. In management plan I got 3. As I mentioned, I did not mention STI screening. And
Mm-hmm.
uh, then
Yeah, that ulcer case you're telling, herpes.
yeah, herpes
Herpes, where
that was
she didn't mention for STS screening,
yeah,
right?
Okay.
yeah, I did.
Mm-hmm.
Yeah, and this case, there's the similar cases in handbook, but it is for male patient. The male patient is having herpes, the ulcers, no? So in this case,
Mm-hmm.
they have clearly written in critical error. They have clearly written if the candidate fails to assess for the sexually transmitted infection.
Mm-hmm.
Oh.
Sana, in this case, we have in primary infection, we have to mention this, or even in secondary, we have to mention this also.
Whether it is primary, whether it is secondary, as I told you, Dr. Tayyaba, as I was taking the history, she clearly told me that she does not practice safe sex. Even
Okay, okay.
practice safe sex, we still are supposed, because as I'm telling you about the handbook case, I did not read the handbook case, but I just checked the critical error when I did the examination. I was looking at the handbook, the cases I got. I was just checking for the critical error. So I only checked the critical error in herpes case. So the critical error was failure to assess for the other sexually transmitted infections.
Okay. Whether it's
Okay.
primary or secondary, whatever it is.
Whether this lady, she had the past history of similar ulcers, and now she's having the same ulcer.
Okay.
And that, as when I asked her that what has happened to you, so she told me that I'm too embarrassed to tell you about it. So I told her, look, I'm a doctor. I constantly, I daily see the similar cases, and it can happen to anyone. Even it can happen to me as well. So no need to feel shy or embarrassed. Just tell me. This is the beginning statement I gave it. But yeah, I still feel the case. They did not mention the the predominant area. Oh no, did they? No, predominant is everything, the management, counseling, and education. Okay, so education is there. Maybe they are also in management. I need to educate her for the safe sex as well. That I also did not mention. Only in management, I was just blabbering all the HSV thing which we have, that it is, I'm going to check you for the immunity, and I'm going, if it is the primary one or it is a secondary one, and since it is not closer to your delivery time, so we are not much. And even I mentioned post delivery, baby ka bhi, we will check the secretions, and we will check everything I mentioned, but they failed me for the STI, I think.
Okay. Thank you.
Maybe she came with the urine, like she cannot pass urine retention. Yes, Sana.
No, there was no retention. She only said that I am having pain, burning sensation.
I was thinking you didn't insert this catheter or suprapubic. So no, she passed urine, yeah?
I
Okay.
asked her that any problem while passing urine. She said no.
Then for STI you need,
She
okay.
just said that if my urine touches the ulcer area, then I get burning sensation. But
So
there is
what? Okay, so what you miss? You miss STI screening and you miss safe sex like that, Kondo.
I
Yeah?
asked.
Yes,
I asked
safe sex advice and STI screening.
Safe sex and STI, key point. Okay. Yes, so now you want to share, sorry, something?
Yeah, that's all I was just telling. In history, I asked. In history, I asked, do you practice safe sex? And she said, I don't. Although I'm having the stable
Did you
relationship.
start her on valacyclovir today? She is 19 weeks.
No, I mentioned that it is if it is it. Sorry, in management I did not mention valacyclovir as well, because in my head I thought that
key point antiviral. It is not pathogenic, even less than 20 weeks. Key point. They mentioned it in RCA, yeah, RCA, yeah.
Okay, yeah, that point I also mentioned.
So this is another.
How was your score on that part?
Which the vulvar lesion? I got
vulvar lesion.
I got 5 in approach to patient. I got 4 in history, and in diagnosis I got 4. In management I got 3.
Yeah. I also same 4, 4, 4, and management plan 3. But this diagnosis and approach to the patient is 4. I don't know why I'm failing this station. It's a 3 maybe. The management plan they didn't mention.
Because
but I mentioned
acyclovir. Sorry, did you mention
I mentioned acyclovir, yeah.
Did you mention prophylaxis at 36 weeks?
Pardon?
Prophylaxis. We give prophylaxis at time of 36 weeks till delivery. We give 2 times acyclovir now and at prophylaxis. 36.
I mentioned now I am going to give the acyclovir, and there was a question management, the antenatal and delivery plan, right?
So acyclovir 2 times. That is another point. Or tutor.
Maybe, yeah. So they
this
maybe
is
I
another.
missed. That's why they put the management.
Yeah, this is the fail. Why 3 you got, guys? Because acyclovir 2 times. Now I give you for 5 to 7 days and 36 weeks self-delivery. Whatever, primary or secondary. That is the key point. STI is the key point. Safe sex key point. Acyclovir 2 times. Whatever, primary or secondary. That is another key point.
All right.
And Dr. Zainab, is it if it's recurrent, then still we have to give?
Yes, Malika. Whatever. In AMC2, don't mention primary or secondary. Just take it easy, please, because the more knowledgeable will be not good for us. Take it easy. STI, safe sex, acyclovir 2 times. Primary, secondary, not my business. Multidisciplinary, obstetric, high risk. That's all done.
Okay.
Key point.
Thank you.
Thank
Okay. Next case I got was the hip pain case, and in the hip pain case, where is the hip pain case? Yeah, I got 7 in the history because history I asked. I didn't know. I don't think I missed any point in the history. Whatever we have from, I did Dr. Amir's course, so I did hip pain from Dr. Amir's history. So I mentioned everything in the history, and they gave me 7 in the history and in diagnosis. And when I entered in the case, my opening statement, he gave me every finding. In the pericarditis case, she just the whole thing, I got the flu like symptoms and everything. She told me she told me in the opening statement everything, that I got previous week the flu like symptom, then I got little bit of cough, and now I'm having the chest pain, and when I move forward, the chest pain get better. And in this case, again, in the hip pain, in the opening statement, he mentioned that I can't lie on this side, I'm having pain, and everything he mentioned again. This, it was in the from the opening statement, I knew it is greater trochanteric syndrome. But still, I asked every, all the possible differentials I asked in the history. And then in the different diagnosis and differentials, again, I gave him all, the whatever differentials I had in my mind. So after telling the greater
Mhm.
syndrome, so he gave me 6, and in a pros 2 patient, he gave me 4. I don't know, he was sitting very happy, relaxed. How should I approach this patient? But yeah. And
Like Mrs. Dorisana, bursitis here?
greater trochanteric syndrome.
Not bursitis, yeah?
No, I mentioned greater
Yeah.
trochanteric syndrome. I did
What
not.
is the positive here, the
Mhm.
physical examination?
No. And then this case, I just don't understand. But now I understand. I got the irritable baby case. In this case, I got history taking was a predominant assessment. The baby was 10-day old. So the lady was crying a lot. She was very dramatic, severely dramatic. Although she did not have any tears in her eyes, but she was constantly pretending to cry. And she was also saying, like, my mother-in-law is not cooperative, she is, judging me all the time and everything. So I thought that, because after history, my task was to do the counseling. So in history, I asked everything. Only thing which I did not ask was non-accidental injury, because I just assumed that it is a 10 days old baby, and why would mother leave this baby alone? So she will be the baby, because she said he's all day crying, all day crying, all day crying. But I have rechecked again. I asked everything in the history except the non-accidental part, because I assumed myself that it can't be there, considering that it is a 10-day baby and mother should be all the time around the baby, and there is no chance of non-accidental injury.
Mhm.
So, but I failed in the history. They gave me 3. So now I can come to the conclusion that the only thing which I missed is non-accidental injury, which I should not have missed, and that's why I failed in the history. I asked everything, even the corneal abrasion and the hair tourniquet and the child health nurse visit, also even in the history, so that maybe I'm missing something. A non-accidental injury I had in my mind, but I still, deliberately ignored it, because maybe the mother is crying already. So I maybe by asking this question, I may trigger her more. So that's why I deliberately
Mhm.
part in the history, and I failed the history. And now I really understand that's the reason, because she told that.
I didn't ask non-accidental injuries, Anna.
But you,
But I got through that is a 4 and 5 and 4, 4.
What was the diagnosis you guys made?
it was
It
infantile
is
colic.
infantile
Infantile.
colic. I said it's infantile colic.
So how did you do that station, doctor? Because you passed it. Can you
I
recall?
asked
Yeah.
what, like, for the first I start with she was very good actor. She was very emotionally, she was crying and very redness, the eyes are red and the whole face was blushed with red. So I was like, first towards the empathy, like, I am here to help you. Then so I make an like empathy and sympathy start, like, then I asked, what is your worry, like, when it started crying, and it is a continuous, or it's what you make it better, did you find any better solution? So did you change any I exclude that any bite, if it is accidental, any bite mark or any ant bite, have you checked the nappies, and have you checked your bed cot and everything, and how is your partner involved with, how is your family support? Then I just, when I'm asked the history, I was like, when she giving the history, like, my mother-in-law is torturing me, she's not, she said is my breast milk is not enough, like that she was towards, like, I thought maybe she had a postpartum. So I just confusing with this patient is infantile colic or postpartum. So then I asked, how is your mood? How is your cooperating with your kids? Do you have any thoughts to make you irritable towards your no, I love my child. She was talking about the good thing to it. So then I excluded the postpartum like psychosis towards the mother history. So there's a history approach. I got 5.
Okay.
And maybe that was the reason, and that was they want us to explore. That if she's complaining about the mother-in-law, maybe she's not feeling better by herself.
I asked
that-
about that thing. She said that my milk is not enough. So I asked that, what do you think? Is the baby we are feeding the baby well? She was like, yeah, he's feeding well. I asked that, is he asking for more milk? She was like, no, he feeds very properly. And I asked about her mood as well. I assessed her mood, and I asked baby for infections, and I assessed the baby for the well baby question. I assessed for the constipation and diarrhea, all the GI differences.
Yeah, that's what I also covered all those points, and I said, don't worry, it is not your fault. It's most of the infant colic that was a child is common. It will resolve within 2 to 4 months. So I will give you such a methods how you can deal with this one. Then your partners and family need to be support in this management. So I just tell that.
Okay, so that when I was doing the counseling in this case, I was constantly counseling the mothers, because I was telling that I will arrange it, because she was saying that no one is supporting me. So I told her that I'm going to arrange a social care worker for you, and I'm going to have a family meeting with your husband as well. So 2 times the examiner said, stick to your task, like properly told me that stick to your task in the counseling. So even I was thinking that if I fail this case, I will fail it because of counseling, because I thought in history, even I'm looking at the notes once again, I asked everything, but I thought when I initially looked at my result at this case, I saw and I thought, okay, I'm failed in the counseling. But now that later on when I looked at my result, so I saw that they failed me in the history. They gave me 6 in the counseling. They gave me 5 in approach to the patient. And in history, she gave me 3 and she failed me. Maybe she got angry on me because of this thing, that she had to remind me 2-3 times that stick to your task, because I did everything in the history. Now again, I'm looking at the only point I missed is non-accidental injury. And for the non-accidental injury, I said that are you visiting, I was like
Sana, they highlight the domain score. It's a high differential diagnosis and approach to the patient, isn't it, in this question?
No, it's history. I failed.
History.
Yeah, it's history. I got 3 in the history. I got 5 in the remaining thing. And in
No, my one it says is that was a highlight. That part is a diagnosis and approach to the patient.
no, I'm looking at this station, the crying baby, and it is
irritable baby.
The crying irritable baby, and it is written that his the predominant domain is history, and I got 3 in the history, and I failed the station. Even in the remaining part, I got 5. I think she was very much offended on me, or what?
No, it means they are changing in the same time. Like